We serve a very diverse community at Hennepin Healthcare. We have ethnic diversity as well as racial diversity. Our minority communities have a mistrust of healthcare and research, and that creates a barrier for them to participate in research. This mistrust really arises from historical trauma. There has been a history where these minority communities in the past were not allowed to access healthcare or participate in research, and sometimes they were abused by healthcare and by research. For the first time, Hennepin Healthcare and Hennepin Healthcare Research Institute have worked together to establish 2 community boards. One of the boards is primarily focused on research, and that's the Public Research Advisory Board. And that board is helping both Hennepin Healthcare and Hennepin Research Institute better engage the community.
In working with the community to inform the research, actually design the research, and not just be, if you will, subjects or persons or families to be studied, is a wonderful gift that is emerging out of all of these deliberations in a very bold, visible way.
The Community Advisory Board, now that we're here, how can we serve as an avenue that starts to open up the doors so that community members start to feel more comfortable walking in and out of these doors, that those who are delivering care starts to expand their awareness and knowledge of the cultural impacts that the patients are coming from or going to when they leave. And then third, that the Community Advisory Board starts to participate in decisions that the hospital needs to make, not reactively, but on the front end.
I'm with the second board that came, and there's some interesting people there because we're not the same, but our goals are the same, and that is better the hospital.
You know, having a community advisory board and extending that out further to more people and more voices and going to where people are is really important. You know, people remember wonderful experiences of caring that they have, and they remember traumatic experiences of caring that they have, and that's what their community then hears about us. So I think we want to hear those experiences. I want to hear those experiences, and I want to hear the experiences where people feel really held and healed here.
A lot of the focus of research that we do at Hennepin Healthcare is focused on the needs of our minority community. There's a researcher who is a Native American, Dr. Casey Dorr. Dr. Casey Dorr is creating lines. These are artificial cell lines that metabolize drugs that are used for kidney transplantation. But they metabolize drugs as African Americans do.
Instead of testing in patients, we can do this in a cell culture lab. We can test how fast these drugs are broke down in cells. And then we're working on translating these dosing models directly into the patient so that they get on the right drugs at the right time, right away. That's one way we're trying to combat these disparities, is getting people the right doses of drugs from the beginning, instead of this trial and error approach which has historically been used.
There's a wonderful researcher here, Dr. Warren McKinney, who is engaging African Americans to show them materials that he's trying to create to better inform the African American community of their choices for kidney transplantation.
One of the kind of essential components of my research is finding ways of making sure that the resources that we make reach African American patients. So this has led me to reach out to the Urban League, NAACP, and local and national chapters for both of those organizations.
I feel very optimistic about the future of research here at Hennepin Healthcare and Hennepin Healthcare Research Institute. Both organizations are really committed to addressing the needs of our community. Our whole health system is now training employees in trauma-informed care, and that's going to go a long way to implement things to reduce disparities in healthcare.
I saw a lot of people struggling with understanding what to do or how to do it in a situation where they were juggling homelessness and chronic disease management. These are issues representative of a lot of deeper questions we're asking in our health system right now about social determinants of health and how to support people in their social, behavioral, and physical health needs, not each in a different wing of the hospital with different provider teams, but all integrated together.